Good morning. I'd like to first introduce our County Executive, Armand Budish, who's here with us today. And he'll share with us his remarks as he does. Before he comes up, I want to thank Armand. He's been an incredible partner. The County Emergency Operations Center has been a lifeline to the community, a way to communicate messages together with the City of Cleveland as we work together in this response very closely with the Cleveland Department of Public Health. That unity message and the uniformity of message helps to assure that the public has the best information from a trusted source, and in emergencies, in my experience over many years, it's the most effective way to communicate. So I wanted to thank Executive Budish for that and give him the floor.
Good morning. This is much better, all separated. That's good. And I want to always start by thanking Terry Allen and Dr. Gullett and their entire staff at the County Board of Health for really the great work that they're doing for all of us in this community. It's life-saving work, and so I can't miss an opportunity to thank them publicly. The crisis that we're going through continues to drive virtually everything that I'm doing, that my staff is doing at the county, and that the people of Cuyahoga County are doing. It's truly life-changing what we're going through here. But I'm so proud of the people of Cuyahoga County. I see examples everywhere of people coming together to help each other. Of course, coming together 6 feet apart, but coming together to help each other. I wanted to give you an update today on just a few of the things that we're doing at the county. And I want you to know that we continue to work through, along with many civic leaders and many partners throughout the county, on how we can provide support during what is both a healthcare crisis and an economic crisis, a terrible economic crisis. When I go outside, I see businesses and stores with their doors locked and lights out. They're closed up due to the crisis. On the one hand, I'm happy to see that people are following the governor's orders. But I'm also very, very sad and very concerned about the future of these businesses. I've run 2 small businesses in my prior life, and I know how tough it is to run a small business even in good times, to make it work. But in times like this, with no income coming in, I'm terribly worried. When a small business closes, when small businesses die, it's almost impossible to revive them. So we have to do everything we can to keep these small businesses alive. They're the lifeblood of our economy. So I brought together experts on small business, and together we came up with a plan. First, we're creating a small business resource call center, which will go live Tuesday of next week. Businesses can call to get information and help about available resources, both in the county, state, and federal governments. And most important, they can get help with applying for the Small Business Administration, the SBA disaster benefits, which can go up to $2 million. That's the place to start. We'll announce the number on Monday to call. Not everybody will be able to qualify for the SBA disaster loans. And some who qualify will have to wait a period of time to get the cash that they need. So today I'm announcing the Small Business Stabilization Fund. The county will put in $500,000 to be matched 3-to-1 by the Economic Community Development Institute, or ECDI. Other partners are also contributing to the fund, bringing the total right now to $3 million. And I anticipate other commitments will be coming too. Our small businesses, which have been so terribly, terribly damaged by the crisis, will be able to apply to this fund for grants and loans to help them get through the coming months. The fund will be available starting April 3rd as we make sure we align these resources with the federal resources that we know are coming. The fund will have a focus, though not exclusively. It'll focus on community neighborhood-based businesses. The fund will be coordinated by ECDI. We'll also be launching a web page where people can get access to important information about the resources and how to apply. Starting April 3rd, people who want to know more will be able to go to the county's homepage, www.cuyahogacounty.us, and click on the Business Resources link under our Popular Links area. I want to say that this is still in formation, so the partners who have been providing the funding for our fund are still working on getting approval from their boards. So I've been asked to not release their names at this point, but that will be coming shortly. And I will be very happy to release their names when I can, because I'm so appreciative of their commitments to helping small businesses in this time of crisis. We're working to do everything we can for our small business community. They are the lifeblood of a community, providing tens of thousands of jobs, and we need to support them. And we will support them together. Now to switch gears. I also want to provide an update on PPEs. PPEs are the protective gear, the gloves, the face masks that people need, especially caregivers in hospitals and first responders. This equipment is absolutely necessary to protect the people so that they can do their jobs to protect us. We have asked for and have received contributions of PPEs from the community. We've been receiving many, many donations to our collection location, and we're so grateful for the generosity of local dentists, veterinarians, Tri-C, CMSD, the building trades, contractors, construction contractors, and others. The people of Cuyahoga County are so generous, and these PPEs will literally save people's lives. They'll save the lives of our healthcare workers and our caregivers and our first responders. They're on the front lines, risking their lives each and every day for all of us in the community. At the same time, I've authorized $1 million to purchase tens of thousands of masks, gloves, gowns, and face shields. We will spend what is necessary to help our hospitals and caregivers and first responders to get through this. It's heartbreaking to see what's going on when you watch the national news, see what's going on in other countries and other cities, what's going on in the hospitals of those other cities and countries. We can't let that happen here, and we won't let that happen here. These are extraordinary times. People are hurting. They're hurting bad. So we'll take all steps necessary to protect our residents, our businesses, and our community. We can and we will get through this. Thank you.
Thank you, Executive Butis, for that leadership. I think that pledge of $1 million for PPE is a real lifeline to our first responders and the medical community, and I thank you for that. That is our major line of defense. So I was talking with a friend who's the Canton Health Commissioner. His name is Jim Adams, and he's really the dean of the local county health commissioners and city health commissioners in the state of Ohio. He's been in public health for over 40 years, and he's often there for sage advice for all of us. I will tell you first, he did tell us, because he has a program, air pollution control program, and they track pollen counts. So the pollen counts for maple pollen are through the roof now. So folks are experiencing, some of us, experiencing allergy symptoms. And so I feel for you, I'm one of those. And he just thought it would be good to share. I talked with him this morning, and he said it was okay for me to share a story he told me yesterday. So Jim was, in the evening, was taking a walk to relax yesterday. And he was walking in his neighborhood, and he slowed down to look at a house where they had what were clearly grandparents standing in the driveway. And there was a little girl, he thought she was perhaps 8 or 9, and she was sitting on the front porch, and she had some gifts around her. And in one of the windows were some family members, and then across the house on the other side were a few other family members in the windows with the windows open. And it was clearly this little girl's birthday. And the grandparents were in the drive keeping distance, and they were all socially distanced. At one level, Jim said he felt bad about the fact that they weren't close together. At another level, he said, you know, they were smiling because they were socially distancing, they were protecting the grandparents and each other. And he said that they were adapting, that they were resilient, and that people are more resilient than often we give them credit for. People are adapting to this new normal because they want to protect people they care about. So that story really stuck with me. And so there'll be times for the face-to-face picnics and spend time with Grandma and Grandpa. There'll be time for the halfway to St. Patrick's Day parties to make those up at another time, and they will come. But right now, right here, right now, this is about protecting our vulnerable folks. It's not only about our healthcare workers and EMS and our seniors, it's other folks that are affected by this and their family members. So we don't want to forget about that. And we are flattening the curve. Dr. Acton said just yesterday that she showed some data that she's been putting together with some assistance from a number of very credible sources, showing that we are flattening the curve. And what that means is that we are extending out, by extending out cases that we may see over time, perhaps from somewhere in mid-April even to perhaps mid-May. What we're doing is we're controlling the flow of things. We're buying time. We're buying time to make sure that the surge issues that Executive Budish talked about are manageable at hospital systems, that they have the equipment and the personal protective equipment available to them that can be produced by flattening the curve, by people staying home, by people not interacting, by businesses doing the right thing based on the governor's shelter-in-place, stay-at-home order, and choosing to work remotely or pausing business during this time, right here, right now, to prevent cases of COVID-19 from spreading in the community. Help to flatten the curve. Dr. Acton continues to show us the way in that regard, and we appreciate her leadership and the governor's leadership. So there's also another resource that Executive Budish and his staff have created. And on the county website at cuyahogacounty.us, there are now translated materials with guidance on COVID-19. And they've been translated in Arabic, I presume both Mandarin and Cantonese, Nepali, Russian, and Spanish. So check out those resources. It helps to reach out to the range of the great melting pot that is Greater Cleveland to provide them guidance. Fact sheets, posters, phone numbers that are helpful for them. So we appreciate that support. Armin, it's a great resource for the community. So our call center has been, frankly, saturated with calls from businesses that are calling us about the governor's order and about their desire to stay active. It's important to know that Lieutenant Governor Houston said it's not the Board of Health's responsibility to determine whether you are critical infrastructure. It's the Board of Health's responsibility to address concerns that may arise from employees or from the community that places that are not critical infrastructure are operating. So that's where we come in. But we've got over 1,000 calls in the last 2 days. Over 1,000 calls in our call center. And the folks are working triple time to respond. But we want people to do the right thing. And you need to ask yourself in your heart of hearts whether you need to be active right now. Because decisions made about that may result in people interacting close together will have decisions that affect people's lives. Right here, right now. So we're doing our best to interpret this order and respond to complaints that arise. So we're asking for your patience on the phone. If you don't get us right away and you get you get turfed to a voicemail or a busy signal, give us a minute and call back, and we will respond. We've got a very resilient group back there. So you can reach us between 8:30 and 4:30 at 216-201-2000. Of note, please do not file complaints related to COVID on our website or by emailing a member of our staff. They are being overwhelmed through those pathways. We use that for complaints that are not related to COVID. So there's guidance on our website. Do not use the complaint form on the website for a COVID-related issue. It's more efficient to use our call center at 216-201-2000. So recently and over the course of time, we've had a number of calls with our first responders. And as I've mentioned before, it's an issue that's close to my heart. My brother is a first responder. My father is a retired Cleveland fireman. And so they're concerned about personal protective equipment and guidance. And so are we. And so our first responders are the main line of defense, and they show up, rain or shine, good or bad, at the door. And I have great respect for that personally. So what we've said to our first responders now is that we need to understand that there's widespread cases. We're reporting what's being tested. So they need to treat every response, every call, as a potential COVID positive case. They need to treat every call that way. So we work very closely with Dr. Tom Collins from Metro Health. He provides EMS direction for the city of Cleveland, and he is universally respected by the first responders. So Dr. Collins and I, over multiple emergencies over the last 20 years, have had conversations with our first responders to walk them through the best guidance. We're seeing incredible adaptations arise. The first responders are using their N95 and putting a surgical mask over the top as a way to protect that N95 mask, put their name on it, save it after the shift, put it in a paper bag, let it dry out, and use it again as a way to try and extend the life of their personal protective equipment. We're assuring that they are taking the proper steps. They're sharing in ways that I think are remarkable, that have always been a hallmark of our first responders. They're sharing PPE, personal protective equipment, across our community to make sure those that do not have access to it. It could be for budgetary reasons or because of usage. So that sharing is happening right now every day. We heard a story from Chief Sweeney in Shaker Heights where they had thousands of N95 respirators with broken straps, rubber straps. And they were able to get a hold of some of the elastic, and they were able to then work with their community emergency response team, which is a CERT. And that CERT team came in and helped to put new straps on these N95s, which then became available to be used in the community. An incredible story. So we want you to remember that your first responders, we want them to be properly protected. We want to try and flatten this curve so that we can make sure that the flow of personal protective equipment that Executive Budish said is available for people as we respond to this to save lives and protect those on the front lines. So let's talk a little bit about donations. And this is another place where Executive Budish has been incredibly helpful. Michael Dever, his Chief of Public Works, and his staff have been incredibly supportive, helping us around donations and equipment that arrives in supplies so that we can distribute those based on where the need is highest. And so I wanted to thank them for that. It's been a wonderful asset. People have stepped up, and we encourage your support for local donations. If you have extra personal protective equipment, take it to the donation center so that it can be used for workers on the front lines at the Cuyahoga County Public Works Garage at 2501 Harvard Road in Newburgh Heights. Gowns, eye protection, face shields, nitrile gloves, disinfecting wipes, and hand sanitizer. All these things are critical, and we're sharing as a community, folks. We have to step up now. If you're in doubt as a business, about whether you want to operate in the community, now is the time to stay home because you're protecting yourself, you're protecting your family, and you're protecting your workers. Now is the time. Unopened boxes of these items will be accepted Monday through Friday from 9:30 a.m. to 2:30 p.m. Kevin Brennan, our communications officer, shared a story from Mayor Ben Holbert from Woodmere. and members of his community are part of an effort to take care of people who take care of people. To take care of people who take care of people. The village is asking donors to drop unopened boxes of protective gear at the Woodmere Fire Department at the door at 27899 Chagrin Boulevard. In order to maintain social distancing, contributors can use the intercom system to alert firefighters that a donation has arrived. And Woodmere firefighters will retrieve the equipment later and make them available to nearby medical centers. Boxes should be marked with what they contain and the quantity and the donor's name. There are a couple examples of efforts too, as Mayor Holbert said so well. These are a couple examples of what they're doing, and that we need to take care of people who take care of people. That's what it's about in times of need, and as I've said multiple times, right now I've never been prouder to be a Clevelander because of the way that people pull together in this town. So I'm going to transition in a moment to Dr. Gullett, who has been a friend, who has been an incredible confidant, who has been a godsend to us here in our response. And I don't know what I would do without her. I want to thank her, Dr. Richard Stacklin, and Dr. Pauline Tarabu. I know that Richard is very close to his PhD, and I think he's very close. If he's not there, I'm going to extend his title as Dr. Stacklin because he's close. You may know him from the flu data that we present. And so what we want to do today is we want to talk a bit about data. Dr. Gullett is, among her many talents, is she's an educator. She teaches medical students. So she's going to provide some background on some data that we're going to present to you once a week. The data will, to the degree possible that's protective, we're going to provide that data and try to provide it in a way that we think is helpful but protective of people. And so we will do that on a regular basis, and then that data will be made available to you on our website. So with that, I'm pleased to hand the space over and the podium over to Dr. Gullett. Thank you.
Good morning. Thank you all. I really, again, want to thank our media partners in the room and those of you back at your offices or in your homes working remotely, practicing social distancing, but working really hard to get our message out and make sure that we're giving all the information we can to our community. So thank you for all of the media partners who've been tireless in their coverage of this crisis in our community. I want to begin today with gratitude for a few groups. I want to continue to highlight, there are just countless people that I could highlight, and I will continue to do it as long as it takes to recognize everyone. But I would like to recognize those in our supply chain this morning, and that means those people who are delivering supplies, not just here to the Board of Health or to our hospitals, but to our food service providers, to our grocery stores. Those are folks who are getting out of bed, leaving their families, and sometimes working really, really long hours to make sure that we all have enough essential supplies for what we need to get through this, especially as we're all quarantined or isolated at home or working remotely from home. So thank you for what you do. That's a critical component to getting us all through this safely. I'd also like to pick up on comments Terry made about our emergency medical services, firefighters, first responders. They're working so very hard, and this is probably the scariest time of their lives. I know for myself and the medical community on the front lines, this is the scariest time in my career, recognizing the risks to our patients and wanting to protect not only our patients but our coworkers. So we thank you, first responders, and we know that you're putting yourselves at risk and you are concerned about your families as well, and so we thank you for your incredible service. I'd also like to recognize a really unsung hero of what we do in public health, which are sanitarians. Those are public health professionals who are the ones who keep your food safe, they keep your water safe, they keep your air safe, and you don't really see them. But without them, we would all be a lot sicker, even in the absence of a pandemic. Excuse me. So I'd like to recognize all those sanitarians all over the local public health community in Northeast Ohio, in our state, and actually across the country. Here at the Cuyahoga County Board of Health and at the Cleveland Department of Public Health, your sanitarians are still working hard to inspect our food service operations at their usual inspection routines. But in addition to that, they're also making sure that we are following up on cases that we are notified about that we cannot reach, patients that we are not in the hospital, that we can't reach by our usual routes. Our sanitarians are going to people's homes and safely trying to make contact with them through doors so that we can make sure that no one who's been diagnosed with this is left uncontacted and that we can then make contact with their contacts. That's our sanitarians out doing that. They're also the ones who are now also on enforcement, and they're going out with the complaints that we're getting around essential businesses and non-essential businesses. So I just want the public to understand that there is an army of folks who are probably invisible to most, but working really hard to protect all of us. So on behalf of the Board of Health, thank you to all of those groups. I'm going to spend some time talking about data today, and I'm going to pause for a moment to allow Heather to transition over to the slides. These slides will be available to you. Every Friday we'll be updating them, and they will be posted on our website. On Mondays and Wednesdays, I'll still be updating our case counts with ranges of ages, dates of illness onset, as well as deaths. But then I'm going to give you more robust data on Fridays that gives you a better sense for what the community scope is of this current pandemic. So with that, I'm going to walk you through a little more today than I normally would because this is a new process, but we're trying to get into a routine to give you everything that we can so that you can report as completely as possible to all of your viewers. Everybody's ready? Okay, great. Thank you so much for your adjustment there. And Heather, thank you for your continued interpretation for us and for being willing to do this pivot to the slides today. So I'm going to begin, as I normally do, with our total case count. This is the Cuyahoga County Board of Health jurisdiction, so this includes all the communities in Cuyahoga County except for the city of Cleveland. Our total lab-confirmed cases, and the caveat to this is this continues to change very quickly, honestly by the minute and hour, and so I have to put a cutoff for these numbers. So when you look at the Ohio Department of Health website later today, it'll be a little different than this. That's because we got more cases since I pulled these data for analysis to present this morning. But as of yesterday, when we pulled these data for presentation, we had a total lab-confirmed case count of 204. The age range is 14 to 93. The date of illness onset is February 29th to March 20th. However, that will change and it will continue to come closer to our current date today. These are just the confirmed information that I have on the cases we've called. So you will continue to see that until we have no more transmission. And I can assure you that there's continued transmission even as late as the last few days. We still have 2 deaths, and the desire of my heart is that there be no more loss of life associated with this. But unfortunately, the numbers are not in our favor in the number of cases we continue to see roll in and the number of patients who are in the hospital and very severely ill in the hospital. So as this continues to evolve, I will again provide additional details on age range of deaths as that becomes available. I also want to just highlight that with regard to deaths in our community, as well as in our state, in our nation, and actually in our world, the families that are dealing with lost loved ones are dealing with grieving their loved ones, but they're also dealing with a different level of coping with their own potential exposure to this infection and their own potential risk to become infected. And so we are contacting these families, and we have made contact with both of these families to express our sympathy, but we also have to take it a step further and ask them difficult questions about their interactions with their loved ones. And then we have to take a difficult step if they are contacts, putting them in quarantine, or if they become symptomatic in isolation. So you can imagine that this has led to family members not being able to grieve in the usual way that many families grieve, attending funerals and such. So I just wanted folks to understand that, because that's a level of this that's very difficult, and we could all sort of imagine it, but I want you to know it's actually happening, and so we need to support those families even more than we would otherwise. I also just want to say, and I've said this at several other press conferences, the level of stigma associated with COVID-19 infection is unlike much else I've seen in my career. I've certainly seen stigma with other infections, particularly early in my career when we were still getting a handle on other infectious diseases. But this one has a different feel to it, and we have had continuing to hear countless stories of people being stigmatized by having this infection or being exposed to this infection. And that's affecting their livelihoods, but it's also affecting interactions in the community as they try to do their essential work. So I just want to let folks know that that's something that we have to, as a community, come together around. And we're really trying to make sure that you have all the information so that you understand this is widespread. This is not isolated to any one group of people, any race, any ethnicity, any particular group. We are all at risk, and we are all in this together. Kevin, I'll take the next slide. This is a slide that many of you have seen. This is one version of the general curve. I'm presenting it this morning before I present our county level EPI curve, or epidemiologic curve. So what we're trying to do with all the efforts I'm talking about every single time is our team here at the Board of Health and our colleagues at the Cleveland Department of Health and our surrounding health departments are working really hard to contact trace, identify every case, isolate those cases as quickly as possible, identify their contacts, and then quarantine their contacts to reduce that curve, to flatten that curve. That's in conjunction with what you've seen from our governor and our state health director, critically important measures to keep us all home. Any interaction is a potential exposure to this infection. So we've all got to do everything we're being asked to do as individuals and collectively as a community to flatten this curve. Because the dotted line that you see there is health system capacity. And if we crest over that dotted line, our healthcare providers will not have adequate resources to give everyone the high quality medical care to save their lives that we are accustomed to in this community. So this is what we're trying to avoid. We are trying to hold back the floodgates so that we never get to that surge capacity line, that dotted line that means we don't have enough resources to give everyone the critical care they need. Next slide. So each Friday I will present to you our EPI curve. You've seen some state EPI curves, and my goal here, our goal here as a team, is that we give you local data that then helps you to understand how, as a local community, we are, what does our local data look like in comparison to the state and then nationally. Our efforts are at the local level. We are trying really hard. We're following the Ohio Department of Health and the governor's playbook, so Dr. Acton and Governor DeWine guide what we're doing. We are in complete step with them. We're doing everything that they are recommending we do. But at the community level is where the action happens to flatten the curve on contact tracing and isolation and quarantine. So that's why it's really important for people to understand our approach and what our data look like. So what you're going to see is that this will continue to evolve. You'll see that there is a lag from our symptom onset all the way through to the testing, but that's because we didn't have testing available. The blue lines, and again, this will be on our website, you can, the public, anybody can download this and look at it. The confirmed illness onset is a lag for many cases from when we had the specimen collection, because that was a product of when testing became available in our community. You'll also know that we've begun adding recovered cases onto this EPI curve, because we also want you to see the success of these public health interventions, which is getting people through this infection, and hopefully then they have immunity, and then we'll begin to build immunity as a community. Our antibodies, our immune systems are beginning to respond to this. So you'll see that evolve as well. The big spikes of the testing do coincide with a significant number of tests that were done around some drive-through testing, which was just publicly reported, but some of that is still lagging in. The test results are coming in. So this will continue to evolve, and that's why I think our team has decided, we as a team would like to present this on Fridays, so it'll give you, if we present it more often than that, it's going to be hard to make sense of what's happening, but if we present it in each week, then you can see how things are evolving by week, and you can also see how that compares with our state as well. Next slide, please. I'm also today going to talk to you about some data our team has decided would be very helpful. We have to make decisions about what data would be the best to tell the story, and we want to give you as much as we possibly can. So I'm going to give you a few pieces today that we as a team feel would be helpful for you to understand the scope of this infection in our community, but this will continue to evolve as well. And if we have other data that becomes available to us that we feel would be helpful to tell the story, we certainly would. We've been talking a lot about percent positivity, meaning how many COVID tests are actually done here in our community and how many of those are positive. That's a really, while it might seem like not a hard number to obtain, it's actually kind of hard because we have 4 hospitals doing internal testing, but we also have private labs doing testing, and we also have residents of our community who have had tests done in labs in other states. And so we've been tracking down all of this information. And we aggregated it, meaning we put it all together so we could give you a percent positive today to the best of our ability. And so we found that when putting all of the tests that we know have been done for COVID in our community, so that's Cleveland and Cuyahoga County, we have a 5% positive in our community to date. That is going to continue to change, and I'd like to make sure people know that our testing is highly focused on hospitalized patients. So if we had been testing broadly across the community, which we don't have the ability to do right now, it would look different because those people may have some other circulating virus and they're not positive. And influenza has been very high in our community. So we have seen a lot of influenza. Early in the drive-thrus, we were seeing about 20-ish% influenza on those swabs. Those swabs never went on to be tested for COVID because those people had influenza instead. So as we see influenza begin to wane, and our influenza report is available to you today as well. I'm not going to talk about it in the interest of time, but you can also take a look at how those data are changing. You'll see this % positive probably change. But this is our best estimate for today, and I will continue to update this as I can. We're grateful to our hospital partners for sharing as much information as they can about their negative tests, which I previously have documented to all of you are not available to us through the state system at this time because of the volume of testing. I also want to share with you that the % of COVID-19 lab-confirmed cases in our community, 29% of those have been hospitalized. That is, they've been hospitalized overnight in a hospital, not just an emergency department visit. This is, they've been admitted to the hospital either on a medical unit or in the ICU. We have had 12% of our cases total have an ICU admission or intensive care unit admission, meaning they needed higher levels of care. I will tell you from stories of my colleagues on the front lines in the hospitals and in the intensive care units, they are managing people on the floor that might at some time, have been an unusual situation, needed intensive care. Sometimes we make judgments about whether someone should have a higher level of nursing care based on, our concerns they might decompensate. But right now, we're having people in the ICU who are very, very sick, and we're managing people on floors who have oxygen requirements and they're battling COVID but don't need to be intubated or be on a ventilator at this time. We also have 26% of our COVID-19 infections in this community are among healthcare workers to date, and this again will continue to change. This is people who work in any form of healthcare. So these are individuals who may work in hospitals, emergency departments, ambulatory clinics, long-term care facilities, other folks who may have any job that's related to healthcare. We call that emergency medical services, firefighters, first responders. That they're all included in this, not law enforcement, but our first responders on the medical side are. And the last bit of information we'd like to share with you in conjunction with our hospital partners, individual hospitals and our Center for Health Affairs Regional Hospital Association. We're all working together. We're all on the phone on a regular basis, multiple times a day. We'd like you to understand the county level utilization. This is just another piece of information that lets you understand how much capacity we have to care for people who are sick from this and how that will change over time. So at the county level, currently we are at 64% of utilization, meaning we have people in the hospital, 64% of 100% capacity. Remember, I gave you that dotted line a few slides ago, and that would explain when we're at 100%. We never want to get to 100%. We want to stay below that. So we're at 64 on the medical surgical. Those are people who don't need intensive care. For pediatric medical surgical, we're at 37% utilization. So we have a lot of availability across our community. For critical care adult, we're at 65% utilization. And for ventilators across our community, we're at 36%. So this is encouraging to us, but if we don't flatten the curve, these numbers will be quite high going forward. And so it's critically important that people don't take this information and say, we've got plenty of capacity, we can get out there in the community. We need you to stay home unless you absolutely need to do essential business. We need you to isolate yourself at home if you're sick. We need you to quarantine if we've asked you to quarantine unless you have to report to work because you're a healthcare worker and your organization has asked you to come in. We need you to please listen to this advice. It is not a suggestion. We need you to do it, or we are going to have problems with our hospital capacity. But I have to say, it's a remarkable sight in here with all the cameras socially distancing and pivoting in this very beautiful move here. Okay, the other thing that we'd like to present to you today, thank you, Terry, for reminding me. I don't know how I skipped over that. This is a map. This is a map of cases by zip code for the entire community. And again, this will be on our website as soon as this press conference is over. And again, every Friday we will continue to give you updated maps. What this does is show you the frequency of cases by zip code across our county. And we're working closely with our Cleveland Department of Health colleagues who also have been working on mapping and also obviously on contact tracing. So closely together, we're trying to make sure that we collectively give you the most helpful information, and we thought a map might be helpful today. What the big takeaway from this map is that all of this, the entire community is affected. We have cases across our entire community. And this map is going to continue to evolve, and we will continue to have more cases. So please understand, this was run, and since this has been run, I can tell you we've had more cases. This is a very recent run, and we've still had more cases since this. So we'll continue to update you, but just recognize that if you see this frequency of infections, everywhere you go in our community, there is COVID-19. So you should expect that you have the potential to be exposed if you are out and about. This is precisely why we're asking you to stay home, unless you absolutely need to. That's the end of the slides. All right, so in conclusion, I'd like to again end by asking folks to be kind to one another. You've heard me talk about some stories. You heard Terry talk about stories. I personally and all of the disease investigation team here have heard hundreds of stories over the past few weeks. We've had the opportunity to enter people's lives, and what a privilege that is in these unfortunate circumstances to hear intimate details of their lives about how this is affecting them. And I can tell you that it is really heartbreaking in many cases. And so I just want you to know that there ever was a time for us to be kind to one another and to really be intentional about loving one another. It's now. And that could be a stranger, it could be a friend, it could be family, but please take that as something that you can do from home while you're staying home. I also want to thank the countless people, some of whom I don't even know who you are, but thank you for emailing us, texting us, calling in to say thank you. Our team, those are the things that keep our team going. All of us, including our media partners, are working long hours, and those little nuggets of encouragement are really what keep us going in the tough moments. And so thank you for that. We really appreciate it. And we try to respond to everyone we can, but I know we've missed some folks, so I just want to say thank you for that, and keep it coming if you can, because it really means a lot to us. We're in this together. We're absolutely in this together. We're in this together, Ohio. As you've seen the hashtag, we're in this together, Northeast Ohio. This is not just about Cuyahoga County. Of course, our regional partners are critically important pieces of this. And we're in this together, Cuyahoga County. And so I want to just thank you all for listening. Thank you all for reporting on this. And thank you all for partnering with us as we try to tackle this and flatten the curve as quickly as we can. I will step away and we can take questions as needed.
Thank you, Dr. Gullett. I want to close on something. So what you see, I'm not going to ask you to pivot to the screen, but that is our family here at the Cuyahoga County Board of Health. I've been here for 30 years, and it's been my singular pleasure to work with an incredible, dedicated group of folks. And Dr. Gullett has expanded that family by including the additional workers that are helping to support our response, and they are example public servants. They are committed public servants, and it's been my honor to work with them. I also want to say, before we take questions, that it also has been my honor to serve for many years now, I think 7 years, as a co-chair of the Ryan White Planning Council. For what we do there is we manage across the Northeast region and provide support system care for a range of social services for over 3,000 people living with HIV and AIDS. And so what we know, the cautionary tale, as we hear from Planning Council members, are issues around stigmatization that they still face today for HIV, that they describe to us and they still face today, that are incredibly unfair, are incredibly unwarranted, and that in the same vein, the stigmatization that we fear relative to folks who may think someone's positive or hear that their neighbor's positive and begin treating people treating people horribly. That cannot happen in this moment in this community. It cannot happen. And so we ask all of you to take a step back, and this is where your better angels need to emerge. And this is where the best parts of our character as a community need to emerge. And I ask you all, and calling on you all to bring that forward and let what it means to be a Clevelander and how we take care of each other shine through. With that, County Executive Budish and Dr. Gullett and I can take some questions.
With the $1 million contribution or allocation for PPE, how much equipment do you expect to be able to purchase with that money?
As much as we can get. And the prices vary depending on the equipment and depending on the time. Matt, do you recall how many we've ordered already and we haven't gotten close to finishing our $1 million?
The big number of the N95s, 100,000 N95s, so at various prices, but that was the big quantity.
And we've ordered over 100,000 masks, and so we're able to buy quite a bit of equipment with that amount of money. It's nowhere near enough. That's why we're still asking for donations. We desperately need donations, and it's not easy to find the PPEs. I could make it $20 million, but if you can't find it, you can't buy it. So this past week, I've probably spent hours and hours on the phone with my counterparts around the country, county executives and commissioners, asking for help, for leads. Where do you know where you can get some of this stuff? And we've been tracking down leads from all over, anywhere we can find. And some of the leads end up with nothing. Some of the leads don't have any equipment right now, may in the future. Some of the leads are charging way too much. But some of the leads have been productive. So we're following every lead we can. If anybody out there sees this and knows where we might be able to purchase more equipment, we're happy to pursue those.
And is that going to be just dedicated for first responders, or does it end up in hospitals, nursing homes?
Everywhere. We'll see how the needs evolve, but when you're looking at the national news, it seems everybody needs the protective equipment. Hospitals, nurses, first responders. I mean, across the board, there's just not enough.
If I may, Armin. So on that vein, I do want to say something. This echoes a theme that you're hearing today, is we're trying to buy ourselves some time. We're trying to buy ourselves some time. Flattening the curve means that we're not seeing this huge increase, the big red curve that we saw, which I think China experienced that during their cases in great display across the world that we all watched. By flattening the curve, we're extending out that peak, potentially from mid-April into perhaps mid-May. That means we're staying below that dotted line threshold for the healthcare system. By extending out cases and keeping them at a lower level over time, we allow time for the supply chain that Executive Budish mentioned to help to come back as we're supplying PPE across the country, to be able to continue to fortify first responders, different types of care facilities, hospitals with the personal protective equipment that they want, that they're trying to get access to. So we're allowing that recovery time to then continue the care, stay under the thresholds that Dr. Gullett showed around bed capacity, around ventilator access. This is all part of the plan, and so you staying home. I saw something on social media from one of my boys that said, it's your opportunity now to lay on the couch and actually help to save this community. I think we're up to the task. So that's, of course, works with my young boys who are home from college and are about to begin their classes remotely. So I would just ask you to take that to heart.
Dr. Gullett, can you talk about the situations in the community where you guys are seeing the most kind of clusters of spread, so that people can understand, is that among healthcare workers, is that at long-term care facilities, is that within families or workplaces? I know that privacy is really important, but just kind of knowing the situations in which the infection is spreading might help people understand.
Sure. I'll repeat that question in a minute. I just wanted to finish up on Scott's question really quick. So we have put together, you heard me on Wednesday, thank our county and our city and county emergency operations center teams are working so hard together, and our emergency management teams, our EMA team, working really hard together, and they put together a really beautiful plan for collection of the donations as well as our strategic national stockpile shipment, and then put together a very thoughtful, appropriate, data-driven approach to ensuring that PPE distribution is getting to where it needs to be. And so many people in this room were part of that, in the county executive team, staff, but also I just want to acknowledge that there's a very thoughtful and intentional approach to that to ensure that places where we identify PPE needs that might not be first, you know, the hospitals are clearly an issue, right? But that we have a lot of other people in communities that are getting care in other places, and so we really walked through that. And there's and that's all coordinated at the county EOC and by the EMA team. So I just wanted to acknowledge them again for that, and to make sure that the public knows that this is a very intentional process. So Rachel's question was about, could I please talk a little bit about the community clusters that we're seeing? And you've heard me talk about a multi-pronged approach here at the County Board of Health, in conjunction with our Cleveland colleagues, around our community's response at the local level, and part of that was a cluster investigation response. So when you identify cases, you begin to then learn about their lives and where they've been, and that's why they're so, it's such a privilege and something we take very, very seriously, that they're sharing these details of their lives for the greater good, so that we can track down anybody who might be at risk for the infection. And in that process, you begin to identify what are called potential clusters, meaning people that they've been in contact with who may have become symptomatic, or maybe they're sick themselves at the hospital and they've already been tested themselves. And so our disease investigation team tracks down all of those. This is truly investigation. And so whenever we identify those clusters, we go in every which direction, and we have doctors assigned to be leads for each of those that we identify. And there are many of them, and we've been doing this for weeks, actually, since our very first cases were identified. And so sometimes those lead us to places that were businesses before the businesses were closed, social interaction, places where businesses happen. They've led us to businesses where people get essential services. They've led us to skilled facilities and long-term care. They've led us to educational locations. They've led us to homes. We have some large families who've been very impacted by this, and so it's our duty to ensure we are able to help them isolate all safely and have what they need. This is why we have a resource team working with EOC and EMA, who I just mentioned, to get people groceries and cleaning supplies and thermometers and those things, so they're not going, and insulin. You know, people's telling us, I need my insulin at the pharmacy, so we send a staff member out to go pick it up and drop it off at their house. These are the kind of things that emerge with clusters. And so I've given you a couple examples without giving you identifying information, and our disease team then determines when we need to sample. We don't have enough testing to sample everyone who may be symptomatic from a cluster. So we try to be very thoughtful about very limited testing we have, and we sample when appropriate in those situations, so that we can identify when there might be any other potential cluster risk that extends beyond what we know about. So that's our approach. We've been doing this. I can tell you there are dozens that we've investigated and dozens that we're in actively following, and we have not stopped following anyone, any clusters, or any cases that we have identified. Even those who have been cleared of infection and discontinued from isolation remain on our tracking list, because we've committed that we're with individuals, the community, and any clusters, any affected organizations for as long as this takes.
Those numbers include hospitals, right? It's not just county residents versus city residents?
Which numbers are you talking about?
Like the percent positive.
Right. So when I presented the very first slide that I presented, so Scott's question is what numbers do those include, what I presented earlier. The very first slide I presented were our Cuyahoga County jurisdiction numbers. That's the Cuyahoga County except for City of Cleveland, because our colleagues are separately reporting on their own numbers there. But we are working together to give the information we can to the community to give the best picture, and we feel like it makes sense to have the combined jurisdictions for those EPI curves that I showed you, and the map. And so the numbers I gave you on percent of our infections that are of hospitalized patients, ICU patients, and healthcare workers is for the entire county, inclusive of the City of Cleveland.
Excuse me. So I wanted to, there's a message here that's very critical, that we talk about social distancing. We talk about hygiene. and the evidence-based hygiene around simple hand washing and surface cleaning and the like, and covering your cough. But so every time someone is isolated or quarantined, they are at home and not on the street potentially transmitting. Every telehealth call that happens through the major hospital systems where someone is saying basically you're sick, it's probably a good idea to stay home for that 14-day period, to stay home and then monitor your symptoms and stay in touch telehealth with your physician and allied professionals to monitor your care, to determine if you do need to seek care and not come in if that's not necessary and try to ride it out like we do during flu season. Every time a business decides to err on the side of caution and look at this critical infrastructure question and say, let's work remotely, let's close down for a few weeks here, and let's try to ride this out. Every time someone says, you know what, I'm going to make the hard decision and we're going to put our wedding reception off, and we're going to have it later so that we can celebrate together with folks when it's a better time and it's better for the community. And every time someone on their own says, you know what, I'm not feeling well, and I'm going to go back, protect my family and my friends, and I'm going to stay home for 14 days and be part of the solution. All these things add up to affect that curve. They're individual decisions that add up to one big community effect about our ultimate opportunity to try to be part of this curve flattening when Dr. Acton describes this on her daily press conferences. And we can see that happen in real time now. So that's what we're hoping people will choose to do, and we believe that you will.
Looking in the crystal ball, is there any way to know at this point, are hospitals here locally expected to reach capacity, exceed capacity? What's being done there?
So the question is, are our local hospitals expected to reach capacity? What is being done to avoid that? So I'll go back to the dotted line on the curve. None of us can predict where this is headed. We have remarkable modelers at multiple institutions trying to ensure that we can take as much information as we have, but without widespread testing, we're crippled a bit in understanding the assumptions of the models because we actually don't know what the levels of infection are in the community. We're using modeling to give you our best estimates, but we know it's high. If I am showing you today, our team has prepared this map and you see it's everywhere, and that's with very limited testing, you can truly only imagine the actual number of infections in the community. And that was what you heard Dr. Acton talking about yesterday and in prior days. So without being able to accurately predict in the way that we as scientists would love to do, we are all about data and we're using as much data as we have, but we don't have all the data we'd like without an accurate amount of testing to know what our prevalence in the community truly looks like. We can only use our best estimates about reaching capacity, and that's why we felt it was important to begin to give you, once we got access just yesterday to the hospital utilization data, and we talked to our hospital partners and said we feel this is important to present to the community so that we can continue to help you understand as a community what our utilization looks like, and as we begin to approach capacity, is there anything else that we have to do as a community to do that? But the message still remains very clear from my perspective and from our team's perspective in that we all have to do our part individually and collectively to flatten the curve, or we will be at surge capacity. And our community has a massive amount of clinical capacity compared to many other communities in our state and in our nation. And so for us, we actually are probably in a better shape with the number of beds without building even new hospitals or adding surge capacity beds. And we still are concerned. We're still concerned. So I would say to you, yes, it's a risk for us here, but if we can flatten that curve and everybody can do what they need to do, and we can get people isolated and we can get people contact traced and people truly stay home and they don't need to be out, then our ability to keep us below surge capacity in this community is better than if people just don't do that and go out and transmit the infection more.
We'll take one more question.
Are there plans right now to add beds, to possibly have all coronavirus patients go to certain hospitals? What's being done to kind of...
The question is, are there plans right now to have isolation or cohorting of COVID patients or additional beds to be built? So I have heard the same things that you have heard from Dr. Acton about a state-level approach with regard to surge capacity. We in public health actually do what we call tabletop exercises, and we actually do them with our medical students too at CASE. That's actually their very first Friday of medical school. They get to do a pandemic influenza simulation, and we talk them about surge capacity, and our Regional Hospital Association partner comes in and explains to them what that looks like. Well, now we're all living that. So at this point, I know at the state level, we're working on understanding what that bed capacity looks like. And then at the local level, we also do that. And our hospital partners are using this information from the Ohio Hospital Association and the Ohio Department of Health to understand when we need to ramp up with regard to beds. But it's such a fluid situation that it's really a constant evolution and a constant reevaluation. So that's what I know is happening at the state level. I do know that certain healthcare institutions have cohorted patients. Of course, isolation is huge right now, and so and that's the advice that we give when we identify clusters and other areas of concern is please cohort those patients, get them isolated, but then also cohort them in a part of your building or in a part of your facility so that we can try to minimize any sort of other spread to unaffected parts of a building or of an organization. But we also know that the ability to do that will continue to dwindle if we have such widespread infection that everybody has it. I know some hospitals have also tried to funnel admissions who we know are lab confirmed or highly suspected to certain hospitals. But again, there are only so many beds in each actual physical building. And so I know that we're working hard to make sure that we're following those approaches, but it's going to continue to evolve. And I think that we should really think about our state approach as the right thing to do and then operationalize it at the local level with regards to bed capacity.
We have this plea for one more
One
question.
more from the cameraman, Doctor, if you wouldn't mind. The dotted line on your chart, does that represent an average of, I know you talk about bed capacity, ventilators, personnel. For example, if you have 1,000 beds available, if you have 10 respirators, and you have 11 people that need respirators, have you reached that dotted line at that point, or, you know what I'm saying, is it averaged out? Somehow?
Yeah, so the question is that dotted line I gave you, which is really just a theoretical representation of this entire situation, and it could be at any level, right? It could be at the county level like we're talking about, or it could be at the state, or it could be at the national level, or it could be international, is looking at what kind of capacity we have from a hospital perspective. And so you're asking me very practically, when is that dotted line reached? Is that what you're trying to get at? So if we have 11 people that need a ventilator and we only have 10 ventilators, we have crested over the dotted line. Very practically speaking. That's just a practical example of that. And I never want to get to that in this community. None of us do. All of us physicians, no physician ever, or no other healthcare provider, or no other hospital administrator ever goes into their job to have to make a decision about not being able to provide life-saving care to somebody. We know how to save people's lives to the best of our ability. Sometimes this infection is overwhelming and we can't do it with the best medicine we have. But we should never have loss of life in this community because we don't have enough resources, we don't have enough ventilators, we don't have enough beds. But if people don't stay home, we will quickly approach 100% utilization of the numbers I gave you with regard to beds and ventilators because the infection will overwhelm too many people in our community and they may need high-level care, and we will have to make very difficult decisions that you see coming out of other countries like Italy. And that is absolutely what we're trying to avoid in this community.
Thank you all very much. I want to thank Heather again for working triple time to support us for hearing impaired. Thank you very much. Be safe. Take care.